I want to first differentiate which type I'll be discussing. Natural sugars such as lactose and fructose can be found in milk and fruit. These are usually better because they're accompanied by important nutrients such as protein and fiber. Added sugars, on the other hand, such as high fructose corn syrup, are added to foods as they're prepared. So they don't usually have the important nutrients that natural sugars do. Added sugars aren't just found in sweets, they can be high in foods such as flavored alcohol, reduced fat dressings, and baked beans. So how does this affect you? A study done in 2002 found that diets that were high in added sugar contributed to a reduction in BDNF. That's a brain chemical called brain-derived neurotrophic factor. BDNF is necessary for memory formation, so a loss of this chemical would affect your memory. Reduction in BDNF also contributes to insulin resistance, which can lead to type 2 diabetes and metabolic syndrome. There have also been significant links between consuming a high amount of added sugar and results in depression, diabetes, and weight gain. So some strategies that you can use to help reduce the amount of added sugar in your diet are reading food labels before you purchase them. Some of the reduced fat labels can be lower in fat, but actually higher in added sugars. So that's something to look out for. Reading the food labels before you purchase can help you understand the amount of sugar in the item, and reading the ingredient list will show if it's a naturally occurring sugar or additives. This can sometimes get tricky as there are so many different terms for it, as we see in the picture at the bottom there. There's maltose, sucrose, corn sweetener, corn syrup, fructose, and so on. So the government is doing a few things to decrease our intake of added sugar. The FDA is currently proposing that an added sugar label be put on all food and drink containing added sugar. This would allow for consumers to have a more clear understanding of what they're buying. As we saw previously, added sugars go by many different names, so it can be confusing just going by the ingredient list. The World Health Organization is also cutting its daily recommended sugar intake in half, from 10% of your daily diet down to 5%, and this is a result of the side effects that we're becoming more attuned to. The American Heart Association is also encouraging that women take in no more than 24 grams of sugar daily, and that men intake no more than 36 grams of sugar daily. These numbers are a result of our nation's rising obesity crisis, which is contributing to non-communicable diseases such as heart disease. So the best way to avoid or decrease some of these side effects from added sugar would be to intake it in moderation. So maybe don't have a soda every day, have one once a week or every other day, because there's a lot of added sugar in that. Try to follow the recommended amounts, which you can do by reading the food labels and educating yourself on the different terms. Thank you.